a lot of people are pointing out the need for change. The huge mandate that was secured in the election back in February, where thousands upon thousands of people voted, and they voted for change. So I'm going to pass over to Mary Lou just to give people an update to set the scene and where she sees formation talks for a government taking place. Mary Lou.
Thanks so much, Deirdre and Fáilte Illig. Can I just echo Deirdre's comments of sympathy and solidarity to every family across the island who has buried a loved one in the most heartbreaking of circumstances, and to those who are sick with the virus. There might be people watching this broadcast who are currently fighting the virus, and we send you every best wish for a full recovery. So while we've been dealing with this national public health emergency in a global pandemic, you're right, Deirdre, the efforts at government formation have been ongoing. And the gist of it is very simply this: Fianna Fáil and Fine Gael have decided that above all else they wish to exclude Sinn Féin from government. Some people might recall that after the last Dáil election in 2016, Fine Gael and Fianna Fáil, or in 2016, Fianna Fáil and Fine Gael were absolutely determined that Sinn Féin couldn't lead the opposition. Well, roll the clock forward, and after the most recent election, they're absolutely determined that we should not have any part in government. And it is an astonishing thing to brag about the fact that you wish to exclude the elected representatives of more than 500,000 people. I mean, that's an astonishing thing, but that's their strategy. I don't think any of us should be hugely surprised by that, because these two parties have held power in this state now for almost a century, and the truth is that they wish to continue in that vein. They're not going to give up power that easily. For our part, we have been in contact with parties, with independents, with everybody who wanted to have a conversation, a real conversation about delivering change in housing, to ensure that people have a secure roof over their head, that housing is affordable, that rents are affordable. Everybody who wants to change our health system and service fundamentally, to ensure that it's resourced, that we have strong public medicine and public services, people who are serious about transforming our childcare system, people who are serious about building a new Ireland, and to look beyond now, but to plan for this decade of opportunity, people who wish to see an Ireland that is united and socially just. We've had conversations and we've done very good work with those parties. But Fianna Fáil and Fine Gael have decided that they wish to form a grand coalition, and they're looking for a party to prop them up in that regard. Today, as you referenced, the Green Party have come out with the statement saying that they're going to move from just, having their toe in the water into, proper formal negotiations and talks. Obviously, what the Green Party does or it decides is a matter for the Green Party and for their membership. But it is absolutely clear that Fianna Fáil and Fine Gael together haven't the capacity or the will to deliver the kind of things that Ireland is going to need, particularly now in a post-COVID, as we move to a post-COVID environment, and when we look to try and rebuild our economy. So the people voted for change. And, some people might say, well, it was all a bit hazy, it was a bit pie in the sky. It was nothing of the sort. When we spoke to people the length and breadth of the state, people were very, very clear what change meant. And for them, it meant a change away from the old ways of Fianna Fáil and Fine Gael to a new way of doing business and delivering for workers, for families and for communities. So Fianna Fáil and Fine Gael is more of the same, when in fact the people mandated for change.
Thanks very much, Mary Lou. That's a comprehensive summary. And I suppose, Michelle, just moving on to yourself, in terms of obviously the executive and power sharing institutions were re-established again back in January of this year, and obviously one of the big challenges that it has faced has been the COVID-19 pandemic. So if you can just give us an overview just in terms of what you think of the approach of the executive. And I suppose we have seen the Taoiseach Leo Varadkar introduced, I suppose, a plan in terms of how they start to lift restrictions in the south. And it's just really your view in the coming weeks for the Northern Assembly, what that will look like.
Thanks, Deirdre, and thanks everybody for tuning in to talk to us tonight. I suppose we all are living in the strangest of times, and we're all being asked to do things that, you know, we just never have done before. You know, being able to manage to stay apart from people for so long. These are all difficult things, so it's hard on people. But I suppose the thing that we have to keep reminding people is that you'll not be asked to do this for one moment longer than is absolutely necessary. The COVID-19 virus is still all around us. You know, it's still spreading and it's still killing people. And, you know, as of today, just over 1,700 people have lost their lives across this island. So it shows you, you know, the seriousness of COVID-19 and why we're having to do the things that we're being asked to do. I think that people also at this time want a wee bit of hope. They want to see that chink of light at the end of the tunnel. They want to know that things are going to be easier again, and they want to know that we're going to get back to some semblance of normality. So obviously in the 26 counties, the report's been published around the road, the pathway to recovery and to easing restrictions. And that gives people some sort of semblance of an idea of actually how things are going to change. So the executive in the North is also looking towards publishing a similar document. I think that it's important that we get that communicated to people as quickly as possible, and we hope to be able to do that over the course of the next number of days, certainly before the end of the week, where we'll set out again just what recovery looks like and what the changes and relaxations look like. I think it's important just that we get that information out to people as quickly as possible. I also think it's important that we continue to work across this island with common purpose, because we know that COVID-19 has followed a similar path in the length and breadth of this island. And we also can see that, you know, if you compare our situation here in Ireland to what has happened in Britain, you know, the death toll, for example, here is lesser than has been in Britain by maybe 50 or 60%. So that's hugely significant. So when the disease follows that path, it's really important that we follow a common approach, and we have that joined up working in both tackling COVID-19, but then even in terms of the recovery and economic recovery, and making sure that people have jobs on the other side of this, making sure that people, you know, have opportunity. And I think that we need to continue to do that. So I look forward to being able to publish details, Deirdre, this week, that we're being able to bring forward that plan and let people see clearly what the relaxations look like and when they look like it, or when we're going to be able to bring them forward. The one thing that we have to be very, very careful about is that you don't want to get yourselves into a situation where you start to relax measures and then you have to reintroduce them again. You want to try and avoid that as best as you can. So everything that you relax comes with a risk. Everything that you relax actually comes with the fact that you have to realise that that's actually going to mean the virus will spread more if people are moving about more. So it's baby steps. We'll have to work our way through this very, very carefully. And we want to avoid a second wave if we can. So we're going to just have to work our way through this over the course of the next months ahead. But certainly, I think we're going to be, for some time now, for some time ahead, we're going to have to adhere to social distancing, and things just won't be as they were prior to COVID-19.
Thanks very much, Michelle. And I suppose just feeding off that, then obviously we know the impact that this has had on the economy and obviously on businesses as well. And we have had a lot of questions in from businesses themselves. And I suppose I'll put this one to Conor in terms of, I have Katie, who's a small business owner. She runs a beauticians, and obviously she's been impacted in her business by the restrictions that have been put in place, and then even as they're eased. In terms of looking at implementing social distancing measures. So it's just really, Conor, if you can outline up to now the support that has been there for small businesses, but then what that will look like as we start to move at easing restrictions potentially, and then looking at the recovery phase.
Well, there's no doubt, and firstly, thanks very much, Deirdre, and thanks to everyone who's listening in and watching us this evening, and they're all very welcome. There's no doubt that, particularly for businesses like Katie's, those personal services businesses which rely so much on close contact with people, that they, people have talked about the tourism and hospitality industry, but those businesses as well have been hit very, very hard and have a very uncertain future, because even with a potential move away from the very strict lockdown conditions, even if that's gradual, social distancing will be undoubtedly with us for some time, until such times as a virus can be established and made available. And that affects particularly people like Katie and her business, and we understand that. So one of the first things, while we understood this clearly to be a health issue, and the primary focus was on keeping people safe and keeping people alive, one of the first things we did in terms of trying to also recognise that the economy was going to take a very serious hit here was we immediately introduced a rates holiday for all businesses, and that wasn't just the tourism and hospitality and leisure centres. That was manufacturing, that was the service industries. So for 3 months, no one's paying any rates, in business rates in the north, and that cost the executive £100 million. And as part of the budget that I introduced in March as well, we did a reduction in business rates. So when the rates kick back in, they're about 18% lower for most businesses then, and that goes on into the future. We also then recognised that not only was there a difficulty in paying those bills, it was a cash flow issue for businesses, and particularly small businesses. So we introduced a measure for small businesses that they could access a £10,000 grant to assist in keeping their utility bills and other bills paid. Bear in mind, a lot of the businesses were able to access the job employee retention scheme that came from Britain, were able to furlough their staff. But this was to ensure that they could keep their premises in condition that they could return to work as quickly as they could. We've also introduced a £25,000 scheme for medium-sized businesses in the tourism and hospitality area as well. And we recognised in doing that there were other businesses that would fall through the cracks, if you like, in that micro businesses, some businesses which are slightly larger than the cut-off point for the 25k scheme, but are essentially small businesses, those in the leisure industry that have large premises, but in essence are small businesses really. And so what we have also created is set aside £40 million for a business hardship scheme, which I hope we'll be able to make announcements on this week, which will look after micro businesses and all of those who have really fallen through the cracks of the other grant schemes that we've brought forward. So there has been a very genuine and serious attempt, and all of that in total has cost us almost about £500 million that the executive has spent in relation to that, to try and keep businesses alive, to try and keep businesses in place so that they can pick up on the other side. And we also recognise that in the rates holiday that we give people, that our clear intention, we signalled this last week, was that we will have a further extension of that in a more targeted way. The first rates holiday was for all businesses, but clearly some businesses have been able to continue to trade throughout the pandemic, and others then have suffered very, very badly as a consequence of being effectively shut down. So any future extension of that rates relief scheme, we will target specifically, and we've been doing the work over the last time to make that assessment. We've engaged academics and others to give us a help to target those who have continued and will continue into the future, and particularly those obviously in the tourism and hospitality side will continue to suffer for some time to come, even if restrictions are progressively lifted. And so what we want to do is ensure that any future interventions on behalf of the executive, and they will cost a significant amount of money, and of course the executive will have to agree them, but that they will be targeted at the people who continue and those businesses who continue to suffer the most. So we want to try and ensure that we have an economy to pick up on the other side of this pandemic. We know it's going to be very, very challenging for an awful lot of people in business, but small businesses like Katie's, we want to see back in place as quickly as we can, once the restrictions are safe to do so, but to try and give them the support they need to keep their doors and their businesses alive until that point that they can get back to full activity.
Thanks very much, Conor. And I suppose this leads into another point of discussion and a lot of questions tonight as well. I've seen obviously CBI during the week had said in terms of economic recovery that needs to be looked at island-wide in terms of both governments obviously looking at this across Ireland. So I suppose I want to put this to Mary Lou in terms of that all-Ireland approach. And another question that has come in on this is from Sarah in Strabane, so lives in Strabane, but works in Lifford, and obviously she crosses the border multiple times in a day or in a week. So it's just really what you think in terms of the approach up until now and the need for coordination in the time ahead.
Okay, well, of course, those those are very, very good and very important questions, not least at this time when all of the talk now is about how do we unwind the restrictions, how do we create a pathway to exit the restrictions. And as Michelle has said, none of us want these restrictions to be in place for one more moment longer than is necessary, but they have been necessary and they remain necessary for now. And the truth is that we will live with precautions and restrictions of some kind up until we have ideally a vaccine or strong antivirals, like a treatment to deal with this awful virus. And we have made the case very strongly from page one that the only sensible, responsible way that we can keep people safe and save lives that should not be lost is to operate on an all-island basis. And our friend who lives in Strabane and is over and back to Lifford knows full well that people, particularly living in the border counties, we live our lives, our commerce, everything ignores the border. Businesses don't care about borders either. This isn't really about politics in the first instance. It's about public safety and it's about biology. We haven't got it exactly as we wish it to be in terms of that all-Ireland approach yet. Certainly in terms of the kind of level of testing and tracing that we need, we haven't got that right on either side of the border yet. But I know that all of you in the executive in the north are pushing very, very strongly for increased community testing. And we're pushing for that down this end of the island as well. So we need an all-Ireland approach in that regard. For the purposes of public health, we are a small island or a small population, and we have to be treated as a single entity. I mean, it's an astonishing thing that you have an all-island, fortress island approach when it comes to animal health, but that there's a controversy when you state the blindingly obvious that to keep everybody safe, to do our very best, we have to protect the island as a whole. So as we move towards relaxation or exit, choose your word, we need to be very, very careful that we proceed in a responsible and a safe manner. As was said earlier, the worst thing that could happen is that you relax measures, infection spreads, and then you have to reimpose restrictions. None of us want that. And the only way that we can really safely map our way forward is to do that on an all-island basis. And then beyond that, to build the economy. IBEC and CBI are 100% right on this. We need an all-Ireland strategy. We need to recognise that our economy is all Ireland. You know, that success, that rebuilding those businesses that Conor spoke about, small and medium-sized businesses, micro businesses, you know, that has to be done and resourced and funded right across the island. We also need to have an all-Ireland approach in terms of service provision. I mean, we have an anomalous situation because in the north we have the NHS, which is not, you know, we know the Tories' view, the austerity agenda that they've driven and the damage that's done to the NHS. People will know that one of the first decisions taken by the new executive was to ensure that pay gap that had been in place for nurses and health workers, that parity issue was addressed. But there's lots more that needs to be done to resource our services. And here in the south, I mean, the government have moved to acquire capacity in private hospitals. I mean, it's a very expensive deal that has been struck. But imagine that to deal with a huge public health emergency, that we had to go scrambling, and I mean literally scrambling to build capacity, because we've known for a long time that we don't need the health service that we need. Truth is, we need an Irish national health service that's island-wide. So it's a very wide agenda, is what I would say to questioners on this issue. And it's something that has to be pursued. And by the way, this isn't just a Sinn Féin thing. This is a common sense thing. This is about, it's also a responsible thing. I mean, my view is that it is reckless to suggest that in the grip of this public health emergency that you could take an approach, any approach other than an all-island approach. And then we need to build our economy. People need to get back to work. Businesses need to restart. And what they don't want to hear is squabbling or cribbing between different parts of the island. I think people now are very prepared and understand the fact that we need to work together. Increasingly, there's an appetite for that.
Thanks very much. And I suppose over to yourself, Michelle, again, just looking at the issue of an all-Ireland approach, an all-island approach to this. I know there was a meeting with the North-South Ministerial Council, I think on Thursday, and obviously discussions then around the relaxation of measures, looking at the issues of cemeteries, which was approached last week, the issue of day trippers, that kind of all-Ireland dimension, the people that do cross the border on a daily basis. If you can just give us a kind of summary or an update on where those discussions have been, and I suppose the focus on making sure that there's a joined up approach to this in the time ahead.
If ever we needed a joined up, coordinated approach, consistent approach across this island, this is it. This is at a time where this isn't about politics. It isn't about following Dublin versus London. It's about doing what's right for the people who live on this island. And I think that we have a natural advantage in that we are an island, and that has stood to us in terms of the COVID crisis. So I think we need to use that to our advantage. We had a meeting this week of ministers across the island, so the health ministers in both jurisdictions. We had a very useful discussion just around sharing of information, because clearly we have a memorandum of understanding, which is basically an agreement between the executive and the Dáil team around the how we work our way through COVID-19. So it looks like at things, for example, the modelling, and interestingly, because there's two different sets of modelling being done on the island, and interestingly, whenever you put the data from the north through the 26th county model, it actually comes out the same. So that shows you that we need to be working together to combat COVID-19. So we've had 4 meetings now throughout the pandemic on an all-island basis to have that joined up approach, and it is just so crucial right now. In terms of the restrictions and lockdown and where we go next, and as I said, the executive will bring forward its plan this week. We have to be guided throughout all of this, and we have been very solid in saying this from the start. We have to follow best practice from elsewhere, and we have to follow the World Health Organization's advice. And they're very clear that whenever it comes to exiting or ending the lockdown, you need to do a number of things. First of all, you have to have the transmission under control. So the virus, you need to be able to understand how the virus is being spread right across our communities. You have to be in a position where your healthcare system is able to cope. So in the event that with people moving around more, that the virus starts to spread more, and then you need more and more people maybe perhaps needing hospital care, your healthcare system has to be able to cope with all of that. We also need to get to the point, and this is really, really a crucial point in terms of it has to be full community testing, tracing and isolating. So those 3 things go hand in hand, and they're crucial if you're going to be able to relax any of the measures. You have to have an understanding of where the virus is. And obviously, because of the British government's approach from the very start of this, they were too slow to act, and we know that. And they abandoned the testing approach. And then that means that we're now playing catch up. Now things have improved, there's no doubt about it. The highest number of testing to date was this week, where there was over 2,000 people tested one day in the north. That's an improved picture, but we still have a way to go, and we need to make sure that we get there, because testing, tracing and isolating is absolutely vital if you're going to be able to make some of the relaxations that people understandably desire. The other area that you have to really focus on in the period now is the issue of nursing homes and care homes, where our most vulnerable people are. And we've seen, very worrying levels of deaths in care homes. So there has to be a very, very focused approach to actually supporting those residents in our care homes, supporting the staff that work in them also. And that needs to be a real focus for everybody. And that's, again, part of the World Health Organization's advice. They say focus very much in places where the disease is likely to cluster. And I think that once you get to the point where you have all those things, then you can start to move back, and you can see how you'll be able to relax. But the crucial component part of easing the restrictions is test, trace and isolate policy being in place and implemented on a daily basis.
And I suppose there's been a lot of questions again coming on this topic, and Conor, I'm going to ask yourself, just in terms of the approach around PPE, around community testing, around that idea of contact tracing as well. And I suppose it just feeds in. Annette McIver had just raised this very area, just obviously a concern on the one hand about the easing of restrictions, and then the need that if that happens in the time ahead for that testing and tracing. And I suppose it touches on the point of the cross-border crossings. I mean, we know up to 30,000 people normally on a daily basis move across the island along the border communities. And it's just to see what plans are being put in place. I know Michelle touched on the collaboration and the need to work across the island. So it's just what collaboration has taken place and what is likely to happen over the coming weeks and months.
Well, Deirdre, as you know, the executive meets now 3 times a week. And this is probably the main issue and takes up the most of all of our meetings. And we will have the health minister there every time we meet. But frequently we also have the chief medical officer, the chief scientific officer, and we interrogate all of these things. And the chief medical officer has said to us that the trajectory of the pandemic in the north of Ireland is on a similar trajectory to the south of Ireland and on a different one to Britain. And I mean, the logic of that is that we follow the same measures as Michelle has outlined. Fortunately, we have had less impact in terms of death and illness that has been seen in Britain. And so I think that's because people here very early on got into the same mode of dealing with this across the island. And we were, in fact, in many areas in lockdown before people were instructed to be in lockdown and treating this issue very seriously. So I think the logic of following through on that and ensuring that we have a coordinated approach to be clear, when restrictions are eased, you are going to see a resurgence of this illness and this pandemic. And what you have is the measures that Michelle outlined in terms of being able to cope with that and ensuring that we keep that critical level below 1. This, as we now all understand, this R number below 1, so that the pandemic doesn't then start to spread again. And the virus doesn't start to spread throughout the community again. So that means that we need systems in place, and we need an approach to this which recognises the fact I live in the border area. I'm only a couple of miles from the border here where I'm sitting tonight, and it was a very fluid situation in terms of work, in terms of families, in terms of actual farms that straddle the border. So we have to recognise that and ensure, as we are on the same trajectory, that we follow a similar path which doesn't cause confusion or actually restrict our ability to deal with which would inevitably be some form of resurgence of this pandemic. And I think similarly in relation to the issue of personal protection equipment has been mentioned, and that I think has been one of the main, I suppose, issues that we've dealt with very early on in the outbreak of this virus. I suppose one of the lessons that we may well learn on the other side of this is that, so much of our manufacturing has been moved to the other side of the world because profit has become the king in terms of doing business. And so people have been chasing profit lines and therefore going to the cheapest places to get, which is now critical material for us and for our health service and for our frontline workers, we now find is manufactured on the far side of the world. And so that has put a real challenge because the health services in both Britain and Ireland have been run down, resources have been run down over many years. When this outbreak happened, everybody was caught very cold, and you can see clearly in other countries like the United States was a very similar position as well. So what we have been doing in relation to that is, firstly, and local manufacturers have been brilliant about repurposing, about trying to rally to the cause of frontline workers and provide this material locally, because that's where the security of supply has now become more important than cost of materials. And as I say, I hope there's a lesson for us on the other side of this in terms of our own manufacturing base here on this island and how we should be self-sufficient in things which are of critical importance to us. And so we've had local manufacturing step up. We do have in the north a supply through the British system as well, which has been very useful for us in recent times. And we've also continued to try and procure significant amounts of PPE from internationally. And clearly, we had, when we originally tried to place an order in China, that coincided with the United States and the Indian government coming into the market and purchasing whole supply lines in China. But we have kept diligently at that work, because we know that whatever we manufacture locally will only go so far to filling a gap. Whatever we get out of the British system will not completely meet our needs, because they are very clear that there are certain items they don't have and won't have, particularly in relation to gowns. So we've continued to chase and try and source and on a daily basis pressed and probing possible contacts around the world. And we are, I think, at a point where we are very hopeful that we can make a significant advance in acquiring PPE for the North, for the health system in the North, something which would hopefully see us through the rest of this outbreak, but also in preparation for a resurge if that happens in the autumn, which would potentially be much more dangerous because it would coincide with the flu issue as well. So we want to ensure that we're not, should we have a resurgence of this virus, that we're not in a position we were 6 weeks, 2 months ago, where our frontline staff are going to work unsure, uncertain, and worried about the fact that they don't have the necessary tools to do the job that we are relying on them to do. And so we've continued to try and acquire PPE, and we're very hopeful that we will have an announcement that we can make very soon in relation to that, because we want to make sure, should any of this reoccur, should the relaxation of the rules cause a further resurgence, or should we be into a natural type of resurgence in the autumn, that the people who will be at the front line fighting this virus for us, they have all of the tools necessary for them. And so I think we need to make sure that that is the case. But in the longer term, I think we have to look at what do we manufacture on this island, what do we do in order to make ourselves self-sufficient, because I would love the idea of these pandemics to be once in a century episodes, but we don't know that that's going to be the case in the future. And I think we have to look at how we do business across this island and prepare ourselves to be able to protect the population that we have here.
Thanks very much, Conor. And I suppose the next question, and this has come up a good lot of times, is around support for local communities. And I'll answer this, obviously, as the Minister for Communities in the North. And I suppose, what we have seen throughout this pandemic, and it hasn't been surprising, obviously, as we're community activists ourselves, has been, I suppose, the networking, the ingenuity, the collaboration of communities right across Ireland. I have to touch on, in fair play, Mary Lou, to all of the dancers in Dublin, when you're seeing it just on social media and that as well. And I know that that's replicated right across all the 32 counties. And I suppose I just want, on behalf of our party, commend all of those community activists, all of those volunteers who have really went above and beyond the call at this time to support their neighbours, to support their community, to support young people and older people who have been impacted by this pandemic. And I suppose my role as Minister for Communities, I want to support you. And since the outbreak of this pandemic, one of the first initiatives I moved on was to ensure that those community and voluntary sector organisations that are funded, that their funding was extended throughout this period. That they had the flexibility to change their terms and conditions to respond to this virus. And we're seeing that right across the place. We're seeing community organisations start up food banks, doing food distribution, and also calling on older people and those who are shielding and self-isolating because of underlying health conditions. To that end as well, I knew that food poverty would be an issue, and obviously even trying to access food during this pandemic for those that have to self-isolate for 12 weeks because of those health conditions. And my department, working with Conor's in terms of finance, and obviously with the executive, we started a food distribution programme. And over the last few weeks, we have delivered over 35,000 food parcels to homes right across the north for those who are self-isolating, but also for families who are maybe falling on hard times. They may have reduced income. They maybe have lost their job as a result of this pandemic. And we wanted to respond to that need and support them at this time. And that's been a hugely successful initiative. I also set up a COVID community helpline, and that was to ensure that residents in communities and neighbourhoods had access to government and had signposting for support, whether that was the social security system, health and wellbeing services, or access to essentials such as food. We also invested in a discretionary support fund. This was a grant in which people who were impacted by COVID-19 could apply for, and I'm delighted up until now that we have invested over 1.3 million in over 5,000 people who have received those grants. We also invested in a COVID Community Support Fund, £1.5 million, that went into the 11 councils across the north. And indeed, those local authorities are working with communities at the grassroots to respond to the need. And I'm going to continue to work with them in the time ahead. So there's been a huge effort by the communities. Obviously, as Sinn Féin, we are embedded in communities. Activism is something that we have always done as well. We want to continue to do that in the time ahead as we start to shape a new Ireland. I think what this pandemic is showing is that the inequality that exists, the economic inequality, the disparities that are there need to change, and those gaps need to close. And in the time ahead, as we talk about recovery, it has to be a recovery based on equality and on rights, and that's something that we want the time ahead. We want to look at community wealth building models, workers' cooperative models, to ensure that we do have economic recovery that works in the interests of people, low-income families, young people, in the time ahead, and to make sure that they are sustainable. As Conor touched on, we may face other pandemics, and we want to build an economy and a society that can sustain through these difficult periods. So that's something that we're going to continue to work on, both within the Northern Assembly, but obviously as we build in terms of looking at unity. And I suppose I just want to touch on, there's been a lot of discussion on social media within mainstream media across Ireland and indeed in Britain. I seen yesterday in The Guardian the talk of Irish unity, and Mary Lou, I suppose I know you spoke about this last week. It's just your view around this. Obviously, we've been through Brexit and we're still working through that scenario as well. We have now been hit with this pandemic, and it shows the need for an all-Ireland and all-island approach to these issues. It's no stranger that as a Republican, it's something that you advocate for anyway. So it's just really your views at this time and in the time ahead in terms of Irish reunification and unity.
Well, as you say, Deirdre, like in any set of circumstances, you and I and many, many others would advocate reunification, advocate unity as the best social and indeed economic model for all of our people. I think you and I and many, many others like us would argue that, those of us living in this island are well capable to decide our own destiny, to make decisions in the collective interests of our people. And I think we all recognise that Ireland needs to be reshaped. It needs to change to ensure that we accommodate everybody who lives there, every person who lives on this island. And when Brexit came along, of course, that was a huge shock to the political system. As you know, we're no cheerleaders for the European project as it is now. I acknowledge its profound flaws. It's lost its way. But the very idea of one part of our island being outside the European Union and the rest on the inside was clearly an absurdity and a very, very dangerous one. And I think, in this debate, and Brexit hasn't gone away, I think it put into very, very sharp focus for lots of people who may not pay attention to politics, who may never have really thought very deeply on the issue of partition, who may not have had a set view in respect of unity, or others who had very fixed views. It challenged everybody to actually reassess things, because Brexit meant, in effect, that decisions taken in London by people who don't live here, who have no real vested interest in the success of our island, our society and our economy, were taking decisions driven by other agendas that could prove absolutely disastrous for us, for our families, for jobs, for people's income levels, their quality of life and citizens' rights. And then COVID comes along, this virus, and you are fighting for lives when you are dealing with this virus. That's not melodramatic, that's not an exaggeration. And you find yourself in a position again, because there are two jurisdictions on the island, because the island is partitioned, that others in London who initially adopted the most reckless, I can't explain or quantify the recklessness of saying, well, we're just going to go for herd immunity and let this virus rip through the population, that kind of laissez-faire approach. And that approach would be on our island in the 6 northeastern counties of the island. I mean, that for me underlines perhaps more dramatically than even Brexit, just how vulnerable the island is left when people far away take big, far-reaching decisions that affect all of us. So I made that point. Some seem to be a bit startled by it. I can't imagine why. I mean, I don't think it's newsworthy, Deirdre, in fairness, that Mary Lou McDonald argues for Irish unity. I mean, I think we're fairly on the record on that. But we need to have a real-time consideration. I would just appeal to people, whatever your politics, whatever your view, to actually now, at this time, in these weeks and months where the stakes could not be higher, to just think again on how we best manage our affairs, and in a very direct way in the here and now, how we best keep people safe. So the Irish unity debate was up and running anyhow, because there's been all sorts of changes all across the island, north and south, and almost what I would describe as a generational turning of the wheel. And I think people are ready now, you see, ready to have the conversation about what a new Ireland looks like. And we're not all going to agree on every point. You know what? We don't have to all agree. In fact, it would be a very unhealthy state of affairs if we did. But I have a strong sense, and I think Brexit, the virus, just the international environment has now really put us in a position now where we need to answer fundamental social and economic questions. And I believe that many of these questions are only sufficiently satisfactorily answered when you go at things on an all-island basis.
Are you on mute, Deirdre?
Sorry, everyone. Just to say thanks very much, Mary Lou. Just to say thank you to everyone. Our time is now up, unfortunately. I just want to take this opportunity just to thank our panel tonight. Obviously, Mary Lou, belated happy birthday, Mary Lou. To Michelle as well, and also to Conor, who I'm told is going to be a grandfather soon.
Yes.
So, congratulations, Conor. Well done. And really just again, all of you at home for taking the time to tune in this evening. We really appreciate it. For those who have asked questions, we have hoped we have answered a lot of your questions. I know there will be more, and I think it shows the importance of having these public meetings. So just to say thanks very much. Continue to work with us. Keep an eye out for other public meetings that we're going to be having, where it gives us the opportunity to update you. And I suppose just in the last is just stay safe and keep your family close. So, Gormila Mayagaf.